So in this video, we will discuss about the key features, diagnosis, treatment, high yield point, and clinical vignette related to paradoxical vocal fold motion, that is PVFM, also called vocal cord dysfunction. So the key features are young athlete with exercise induced dyspnea and inspiratory stridor. So it will differentiate from the asthma. So asthma also aggravate the exercise. So expiratory wheezing in asthma, while in case of inspiratory stridor, very high yield. So no improvement with asthma treatment. So the triggers exercise, strong smells, and stress. So, so it is associated with throat tightness, difficult inhaling, while the problem in asthma is exhalation. So resolve quickly after passing out, self-correcting vocal cord movement, repeated unnecessary intubation may before the diagnosis. So the diagnosis typically made on the laryngoscopy. So normally physiologically, so vocal cord abduction. So vocal cord abduction normally during exercise. But what happen in paradoxical vocal fold motion? So the adduction of vocal cord take place during the inspiration in the exercise. So pulmonary function tests show flattened inspiratory loop. So next we will discuss about some high yield clinical vignettes and treatment. So this is a treatment. How will you treat? There are two things: acute case and chronic. So acute case, during attack you will treat sniffing and panting. So this activate the posterior cricoarytenoid to abduct the vocal cord. Super high yield relaxation technique, staying calm and taking slow breath and reduce symptoms. So non-invasive positive pressure ventilation NIPPV used in severe cases. Avoid intubation because the case is self-resolving, right? So long-term treatment, prevention and management. So speech therapy is the most important. A speech language therapist teach breathing technique to control the vocal cords. So this is a super high yields. In case of the during attack, sniffing and sniffing, so which activate the posterior cricoarytenoid to abduct the vocal cord. While in case of the long-term management, so speech therapy is the most important. So relaxation and stress management. So avoid the triggers. We already know about the triggers: exercise, strong smells, and cold air. So the key takeaway of the USMLE. So paradoxical vocal fold motion is not asthma, and inhaler don't work. The best treatment is a speech therapy to train your breathing, and during an attack to try sniffing to open your vocal cords. So this is a first clinical vignette related to paradoxical vocal fold motion, right? So 17-year-old female track athlete present with SOB and noisy breathing during exercise. Her symptom resolved shortly after stopping activity. She has been diagnosed with exercise-induced asthma, but treatment with an albuterol inhaler has not improved her symptom. So examination reveal inspiratory stridor rather than expiratory wheezing. Pulmonary function tests show flattened inspiratory loop. Which of the following is most likely diagnosis? So the which of the following the things like inspiratory stridor, one thing, so flatten inspiratory loop, and it is not treated with albuterol. So it's not a asthma, exercise induced. So it's a typically paradoxical vocal fold motion that is also known as a PVFM, also known as a vocal cord dysfunction. So now I'm going to show you the detailed explanation of this vignette. So this is the detailed explanation of this vignette. So the we already know about the correct answer, that is a paradoxical vocal fold motion. So the episodic dyspnea and inspiratory stridor during exercise that does not improve with the bronchodilator, which is a characteristic of paradoxical vocal fold motion. So key feature again inspiratory stridor in the vignette resolve quickly after stopping exercise. So triggers unresponse to asthma treatment. So the treatment and diagnosis, the laryngoscopy, pulmonary function test revealed flattened inspiratory lobe. So why not the other choices? So this is the detailed explanation. Why not the other choices? So bronchial asthma. So bronchial asthma. Why not a bronchial asthma? Because there is an inspiratory stridor in case of the bronchial asthma, expiratory wheezing, right? So it's not exercise induced involve expiratory wheezing, not a stridor. Respond to albuterol, right? So in this case, it is not resolved. Laryngomalacia, so stridor occur in infant, not in adolescent. So pulmonary embolism, sudden dyspnea, pleuritic chest pain, not inspiratory stridor. So second clinical vignette related to paradoxical vocal fold. So a 19-year-old female swimmer report episodic SOB and throat tightness during tense training. She was previously diagnosed with exercise-induced asthma, but symptom had not improved with inhalers. On examination, she has a inspiratory stridor during exercise. Pulmonary function tests are normal at rest. Which of the following is the most appropriate initial treatment for this condition? So this is what is the most important treatment. Corticosteroid does not work. Endotracheal intubation, positive pressure in case of the severe cases, Monteleucast. So speech therapy is the most important. Breathing and sniffing in case during attack. So now I'm going to show you the detailed explanation. So the correct answer is a speech therapy. So speech therapy is very important for the long-term management. So patient has a paradoxical vocal fold motion that is also known as a vocal cord dysfunction. So in case of this key clues, no response to asthma treatment, inspiratory stridor, throat tightness. So that's why it is a inspiratory stridor. The key thing is inspiratory stridor. Best treatment is a speech therapy, right? So this is a key takeaway for the USMLE Step 2 CK. That is a very important. Paradoxical vocal fold motion mimic asthma but involves inspiratory stridor and does not respond to inhalers. So triggers exercise tests, strong smells, diagnosis again laryngoscopy and vocal cord closure during inspiration, and treatment is speech therapy.